Thank you. Good morning. My name is Lizo Mazwai. I am the chairman of the Office of Health Standards Compliance Board. This board was set up in 2014, primarily to look at quality and safety of users of health establishment throughout the country. And it is, in fact, a regulatory body. In order to regulate, we had to develop norms and standards, which were already prepared by the National Department of Health. We adopted them to apply to all institutions throughout the country. And when you say all, we're talking in the public and the private sector. And even in levels of care, from the primary health care, clinics, tertiary hospitals, and academic hospitals. For the function or the modus of operandi is inspections. So we visit institutions and we've got a schedule of things that we inspect for according to the norms. These are carried out, discussed with the head of the institution, and once they are said to be okay, then they're put out to the sort of public area where people can have a look. We've had a run over the last 3 years because the board or the office is 3 years old, covered somewhere between 35 and 50% of the public health institutions. We have not been able to do inspections in the private hospitals because we're still waiting for the promulgation of the regulations by the minister. We've been working on those for almost a year. Interestingly enough, it turns out that we need, apart from the regulations, some form of guidelines, because we found that these hospitals were not built with this inspection in mind. And therefore, when we came, we found that inspecting was not easy because they are not geared for that. So we've had some what we call stakeholder engagement in the provinces, where we will hold workshops to try and help the institutions to build up. We're looking for that kind of engagement with the private hospitals as well. At the moment, we are actually developing, apart from the regulations, a set of guidelines which we think will help the inspection. Ultimately, when the inspection has taken place, there will be certification that they comply, hence the name of the board being standards compliance. That compliance is a certificate which they will hold for about 4 years because we will do reinspection every 4 years. You may ask what happens in the interim, because things change quite a lot in institutions. So we're also putting up a system of self-assessment evaluation every year where the institutions will send in reports. We also will respond to areas where there are complaints, either public or individuals, to go and do inspections, not just by rotation, but on demand. At the moment, as I mentioned, we're probably covering about 30 to 40% of the institutions in the public sector. What we're looking forward to is really to translate this thing not just to a matter of tick box compliance, but looking at quality. And because of that, we've had to do reinspection, where we make recommendations, institutions to improve on certain aspects. Would give them a certain amount of time, 3 months or so, depending on the seriousness. We would go back and reinspect the institutions to make sure they're up to standard. At the moment, we're using something like 70 to 80% as being satisfactory. But obviously, even that is important. I mean, if there are areas that are critical within the hospital, like theaters, neonates, then it's got to be 100%. We would like to see that translate into a quality and safety, and the hospitals can be certificated. We do hope that this process of certification will make it easy for the NHI boards to accredit, because to participate in the NHI, you need a different system, which is accreditation. And it's all going to be based on those inspections and certification for quality and safety in the institutions. Right now, we'd like to engage a little bit more with not just the provinces now, but also the private sector in terms of conversation, how the process is going to unfold. Because you can have the rules and have the regulations, but as a country, we need a conversation and engagement, which makes sure that we all are on the same wavelength and we are all looking at the same outcomes and goals for a healthcare system that gives quality to everybody. Finally, South Africa has got specific challenges, and these are around issues of access to health, affordability, and as I mentioned, quality. All these will be taken into account as we prepare reports and recommendations for the institution's health establishments. Thank you.